Good evening, AIM Board of Directors. Looking so forward to seeing all of you on Tuesday at 5:30 for our review of the first quarter of 2023. We are a little behind schedule on our board meeting, so we'll do a little bit of catch up also of how we're doing in Q2. Here's a quick draft agenda. If you have any agenda items to add, please send them along. Tomorrow, the Finance Committee is meeting, so you'll get a more thorough financial report at the board meeting. I'll just go through it quickly right now. Okay, so here's our agenda, and I'll just run through kind of what to expect on Tuesday. We always start with our mission. AIM is bridging the gap between research and access to care for youth struggling with their mental health. We do that by finding, funding, and implementing evidence-based treatments, empowering youth to discover their own mental health solutions, and training caring adults to create safe communities. And our vision is we aim for a world of mentally healthy youth. So here's a quick snapshot of our financial position. We're in very good shape. So income, our actual income for Q1 was $430,482. We budgeted $366,000. So we're $64,000 more over in income than we had in the budget, which is good news. More good news is the expenses are lower than we anticipated. So you can see that we have a $22,000 difference. We spent $22,000 less than we had in the budget. So the good news, according to the budget, we're $86,764 ahead of budget. That was at the end of Q1. And so you can look at the actual and the balance and the net and all that. So we're in good shape. And our cash assets are at $727,000. That was again at the end of Q1, but I'll have the more updated. I'll give you a snapshot of where we are year to date when we meet on Tuesday. Okay, so great. So we're going to go over our strategic goals that we set in place at the end of 2021 and 2022. And we see if we need to revisit them, but I'm going to evaluate where we are based on our goals. So goal number one is to improve the quality, consistency, and accessibility of evidence-based treatments that address youth mental health challenges by finding and funding research protocols that bridge the gap between what we know and what we do. So we just last week awarded 4 grants, 2 clinical science fellowship grants of $50,000 each. One went to Dr. Madeline Abel from Harvard, and one went to Dr. Sylvia Vargas from UCLA. We also gave 2 implementation and equity grants of $10,000 to Dr. Amanda Tamman of Baylor and Dr. Galen McNeil from UCLA. What I really love about 2 of these grants, the one for Madeline Abel and Galen McNeil, is they are taking kids off the current wait lists and bringing them into their research. They're implementing modified versions of CBT for faster access to a shorter version of CBT and measuring the impact of that intervention for kids who are currently on wait lists. And as we know, the wait lists for mental health services for youth are just so long. And so those really do bring treatments to kids more quickly. So those are great. And then interesting, Dr. Amanda Tamman is actually, she's studying psilocybin mushrooms it's been showing some great results in youth mental health and treatments for depression. So those are some of the grants that we're awarding, and I'll share more about that. And I'll interview our grantees, and then you can get to know them that way. Okay. Also, another way to bridge that gap is between what we know and what we do happened at the symposium on April 19th, 20th, and 21st. It was phenomenal. I was so proud. We had 846 attendees. That is up from 200 last year. So 846 attendees over the 3 days. There's a link. I'll send you the PowerPoint. There's a link. You can please review the agenda and content. And I think Patty Lusk, if you will, Patty, share with the rest of the board some of the takeaways from the symposium. And we got the surveys back, and our average results on a 5-point Likert scale are 4.5 and above, pretty much in all categories. And the cool thing was it was led by our AIM youth ambassadors. We had youth ambassadors at all the tables leading discussions. We had presentations, 2 plenary presentations from our youth panelists, our Ideas Lab, another youth panel from Alcove, and then youth were able to introduce the speakers. And so they were really woven into the leadership of the 3 days. So our next goal, to put in place talented board staff, key volunteers with individual and collective clarity of purpose, knowing our goals and our responsibilities. So I do want to tell you, those of you who don't know, that Brianna, our former director of organizational development, found another job, so she's no longer at AIM. So this team has come together to hit the ground running, and everybody, we had a staff meeting where everybody took a piece to hold it together so that we can, until we find a person to replace Brianna's role. So in the meantime, we found a very talented Salesforce consultant to help us, and our bookkeeping was already being moved over to Bev Peltzer, and so the bookkeeping is just going so much more smoothly. So we're in a good position to hire somebody really strong, and so we'll be filling you in on how that goes. Okay, so here's the current, like how the programs are run and managed. The AIM Ideas Lab and the AIM Youth Ambassadors are run by Jenny Lang. She's in charge of those programs. Youth Mental Health First Aid, run by Olivia Schultheis. These 2 women are really are building and growing these programs. Whoops, I'm sorry. Hold on, here we go. Pamela Clemens is running our programs in Marin County, and we got some good press in Marin County. The Marin County youth came down to the symposium. Monterey County, Margaret Dorigo is running our programs, and she's the Vice President of Youth Empowerment, overseeing all of this. And then the LA AIM Youth Advisory Board and the LA Speaker Series is being run by Sydney Stillwell. And so I put that in there, mind movement and meditation, and Sydney can share more about that program. And then in San Luis Obispo County, those guys are really just nailing it. They are expanding, and their programs are running. Just last Thursday, the AIM Ideas Lab youth from San Luis Obispo County presented their findings from their surveys to the superintendent of schools was there, teachers, parents, in a community building. And so we're going to expand that, give these youth more and more opportunities to share their data and recommendations on what we should do about youth mental health. And Dr. Friedman is putting together the AIM Institute for Evidence-Based Practice, which we'll be sharing more about at the board meeting, and parent office hours. These are office hours where parents can log in and ask questions of a therapist. Some of these parents have their kids on long waiting lists, so they can these therapists can help parents kind of manage their while they're waiting. You might hear a little bit of background. My daughter just came home, so we'll deal with that. Okay, so the next one is to raise the general level of knowledge about youth mental health among both internal and external stakeholders, and including the community at large. So as I talked about before, the symposium obviously does that. And then in doing that AIM would emerge as a trusted, respected, and relevant thought leader in the national youth mental health community. Again, the symposium is doing that. Our grants are doing that with grant making, with our scientific advisory board. Look at our scientific advisory board. They raise that level of respect. These are some of the best minds in the field helping us strategize where to give grant funds. Then the symposium, like I said, top speakers, Dr. Mark Brackett was amazing. We had speakers coming from all over the country, and our and some local speakers. And so we really raised the level of knowledge. Definitely, that was a good strategy to do that. Youth mental health first aid. We train adults in strategies and tools to support youth who are having a mental health crisis or challenge. And also the AIM Ideas Lab. The AIM Ideas Lab raises the general level of knowledge, especially among peer-to-peer, among youth. Walk and Rally raises awareness. We had to postpone, I'm not going to say cancel, just postpone the Walk and Rally this year. With Brianna leaving and the Gala happening on September 14th, we just couldn't pull off another event without having it pull away from the Gala. So we're going to postpone that to another time. LA Speaker Series, I think Sydney's had three, maybe three, before in the LA Speakers, bringing speakers, people with lived experience, doctors, to have just these workshops, one day, small conferences around the LA area. And then the design challenge. So there are the depictions of the artwork and the ad contest, all of that. I know you've seen those pieces that span our office. We had the presentation of this year's design challenge pieces at the symposium. Amazing. So that really does raise the conversation. Okay. And then the parent office hours, that's actually raising the awareness of parents. And having AIM really emerge as a trusted place for people to go with relevant, thoughtful, evidence-based information. So now, program sustainability. My goal, one of my goals this year and last year has been to create programs that can sustain themselves. So here's what we're working on. Okay, so our research grants, the grants that we give every year, we will give about $150,000 to $200,000 in grant awards. And then that takes about 75% full-time equivalent staff expense. So we figure that the budget for that program is $275,000, which must be raised in order for us to give that those grants. And then youth mental health first aid. We are breaking even and even making a little bit of profit. It's not really profit, it goes back into the program, on all expenses, because we charge $95 a person. So I give you an example here, for a training with 25 participants, that's $2,375 that they pay to take the course. We have to pay the National Council for Mental Wellbeing. By the way, on the side there at the slide, that is Tremaine El Amin, who came out from Washington, D.C., who is the national director of youth mental health first aid in the country. So she came and spoke at the symposium and met with our trainees and all of that. It's great. And so those are the fees that we pay to the National Council, $24 per participant. So with 25 people, that would be $600. And then we pay our trainers $500 each. If it's staff, we have to figure that in too, because that's our time. So there are usually 2 trainers, so that's $1,000 per training. So that would net us $775 per training. Every time we do a training of 25 people, the way this rolls out is we would net $775 per training, which will help to pay for other staff fees. So it's breaking even. That's great news, because we can deliver a service and not have it cost us, just take out from our expense, to be a big expense. We still do get grant funding for this program, and that grant funding can then go to offer scholarships to parents who can't afford it, or people who work with low-income, underserved kids. Okay, so the symposium. So here's the good news. The expenses and revenue, there's a link to this where you can see, maybe I'll see if I can, let me see if I can do this, get this back. We can see the revenue and expenses. Does it work? No, it does not. That's not the right one. Okay, I'm going to go back here to my PowerPoint. Okay, so I'll show you at the board meeting. So we had sponsorships and we had revenue of about $53,000 with ticket sales, sponsorships, and ticket sales and sponsorships. And then our costs were 60 something. And so it cost us $11,742 to put on the symposium. We anticipated that. It's in the budget. It's actually in the budget for more than that. Last year, to put this in perspective, last year, the symposium cost us $17,000 to put on. And that was a one-day conference symposium with about 200 people. And this was a 3-day symposium with more than 800 people. So that is great. Okay, so the goal over next year is to be budget neutral next year, and then create the go-to youth mental health symposium, the best youth mental health conference in the country, so that people will come from across the country. And so it will be a revenue generating endeavor for AIM. That's my goal. Ideas Lab, this year and last, the Ideas Lab was run with volunteer mentors, and Jenny was paid as a contractor to run the program. And then we hired her to build the program and to go more deeply into the program. We hired her as staff as a program director for the Ideas Lab. So with Jenny's time and other staff time, that's about a little over $100,000. These are rough estimates of staff time that it takes to run the Ideas Lab. And then we need to pay our mentors. We've been running on volunteers. That's not sustainable. It's not scalable. So we need to budget about $60,000 a year to pay the mentors to run all of the labs. I don't even know how many labs we had this year. I should know that off the top of my head, but ask me and I can know by Tuesday. So it's about $160,000 to sustain that. We get about $100,000, a little bit more than that, in grant funding currently. So we're looking for additional grant funding to be able to budget this much money to grow and sustain the program. We want to go statewide first, and then we'll take it nationwide. Because imagine if we had youth in all the counties across California, surveying their peers, pooling their data, comparing their data, and reporting to policymakers, researchers, organizations like us, educators, all people about here's what we can do, here's what we know. That is great information for our state to have. It's great for each county to have. And it's especially healing for each one of those youth who participate. There's not a report presentation from the youth that goes by that we're not all completely moved and, really motivated to do something more. Okay, so we're going to look at opportunities offered by Dr. Friedman. Ramona, you're going to meet Ramona at the board meeting, but I just want to go through this real quickly. Parent office hours. Parents log in to Zoom for a Q&A with clinicians over various mental health topics. They can go in anonymously, or they can show their screen, or they can put questions in the chat, or they can send questions ahead of time. This is because parents need some support as they're waiting to get to therapy. So we already have clinicians lined up to run the office hours. And then the AIM Institute for Evidence-Based Treatment. I'm going to go through this quickly because this is something that we're thinking about in the future, and we can have a discussion about it. But I just want you to know that Dr. Friedman she's supervising clinical psychologist in evidence-based treatments, and she's fantastic. I just can't wait for you to meet her. Okay. So, all right. Now, drum roll, please. I won't sing for you all this evening, but we have Hamilton. We have the cast of Hamilton coming for the gala. This is a tremendous opportunity. And I want to have us all set a goal. Our goal, goal number 5, our strategic goal is to become a well-funded, sustainable organization. And we can do that by we're going to shoot for raising $2 million a year and keeping our expenses at about $1.5 million. So at Hamilton, at the gala, let's set a goal to net $1 million. If we can do that, I don't know how much we'd have to gross. We'd probably have to gross about 1.5, but I think we can do it. And if we don't set a goal, it's not going to happen. So that could be a very successful evening. Try to get 400 high net worth individuals We need your help in getting sponsorships. We've got sponsorship packets ready to go. So just get in there and we can talk about who we can get to sponsor this amazing event. We need auction items. Susan will talk about that. Susan, this is Susan's part at the board meeting. So you hear from Susan about the plans for helping make this gala the most extraordinary ever. Okay, so we'll have a discussion about that. Staff update, I told you, Bree found another job. We're looking for a director of operations. Also would love to be able to hire development directors, one in the Bay Area and one in LA. There's so much potential that's being brewing there with all of our good work that we need someone who can go and capture those donors, get them into the AIM fold and invite them to join us as major donors. So those are actually 3 positions that we really like to fill. Okay. And I'm just going to go through these quickly. I'll send these out to you as I send this PowerPoint. But if you remember at the end of last year, when we did our board staff goals, we're going to review these. I'm reviewing these with the staff now. Sydney, you can see all of these amazing staff. We did lose Brianna. And then this is Dr. Friedman's goals. And some of these we've already achieved, helped curate the scientific symposium to ensure relevance. She was such a big help with that. Yeah, I'll go back to Jenny with the Ideas Lab. Yep. And Pamela in Marin County. And then Olivia with mental health first aid. The one thing I'm really proud about our staff is everybody, they know what they're doing and they have they've set their own goals and they're measuring themselves against their own goals. And it's good. And then Paola Vargas, she's been our intern. She's going to do her capstone project with AIM. She had such a good experience being our intern that she's going to do a capstone project to help AIM reach out to the Latino community. She's going to help translate and interpret our materials, our outreach. We already do youth mental health first aid training and Ideas Lab. We have Spanish speaking opportunities for that too, but she wants us to really reach out with fundraising, do a lot of outreach and marketing in the Latino community. I'm going to do a Spanish speaking interview in like next month. So Paula, that's going to be what she's going to look at helping AIM do that. So we're excited about that. Okay. New business and discussion. Think about things you want to bring for discussion. Hopefully you've all watched this. So we got this kind of out of the way so we can go through the board meeting, having a strategic discussion about where we want to be and what we want to do to impact youth mental health. Thank you all so much for your service on this board. And I'll see you soon.